Good day.
Good day, doctor.
My name is Dr. Cupido, and we met the last time when we discussed the biopsy.
Yes.
How are you feeling today?
I'm not doing too well, doctor. I'm still getting a lot of pain on my chest. It's very bad. I can barely sleep at night. Yeah.
I'm sorry to hear
Very,
about your
very
pain.
bad.
And tell me a little bit more about your pain.
It's very bad pain. It's always there. Even if I take some Panado, the pain is still there. It's keeping me up at night, most nights. Yeah.
Oh. And tell me, are you alone at night, or is your family there?
Um, I'm basically staying alone. Well, if you count my dog, it's just me and my dog. But yeah, it's just me most of the time.
And tell me, your dog. Tell me a little bit about your dog.
I love my dog. It's like my companion. And wherever I go, he's there with me.
Is he one of those dogs that sleep on the bed with you?
Definitely,
Ah,
definitely.
so that sounds quite like a real companion.
A real companion.
So I would really like to discuss the management of your pain. And today we're going to concentrate on seeing if we'll be able to get your pain better controlled.
Yeah.
So firstly, I just want to explain what I suspect is causing the pain. You are aware that we did the CAT scan.
Yes.
And that the CAT scan showed that there is spread of the cancer in the lung to the ribs. And that's one of the reasons why when you are breathing and moving, you are constantly having pain. Now you said that the Bernardo is not working for the pain.
No, it's not working.
Okay. So the next option is that we can start you on some Morphine,
Okay.
which is a stronger painkiller than Bernardo. I must say that you're not eating so well. Usually you take the Morphine after you've eaten, because there is a risk that the Morphine can cause some ulcers in the stomach. What do you think about that?
I don't know. Don't you think it's a little strong for me?
So the Morphine is definitely not a very strong tablet.
Okay.
It will have no side effects in terms of drowsiness or nausea or anything.
Okay.
The biggest concern would be that you may develop an ulcer. But from my experience in managing patients who have this kind of pain, we very quickly are probably going to have to move on to having you on something much stronger, another painkiller, which is called morphine.
No, doctor, I've heard about the morphine, and I had a friend who was using drugs before, and I heard that morphine can be addictive. I'm very worried about, something like that.
Okay.
I'm very worried.
And tell me, what happened to your friend?
Well, my friend was known to use other drugs, but he was also using heavy drugs. And I don't want to get to be addicted on drugs. That's why I'm a little bit worried when you mentioned the morphine for me.
I can understand your concern. So it sounds to me like as you say, your friend was addicted to drugs. Did he by any chance, um, you know, was he constantly using it? Was he constantly talking about getting drugs and things?
Yes, and the last time was actually the overdose. So I'm also worried about, things like that. Um, yeah, it's making me very worried.
Absolutely, and I agree that one should be worried. And I'm sorry for your loss of your friend as well. Um, so, just to explain, uh, there is a difference between addiction and, in our case, we probably not looking at that. But addiction is was your friend in any pain?
No, he was not in
Okay.
pain.
Was he sick at all?
No, he actually was a fine person.
Right. So he had a craving for this drugs, and as you said, he started with small drugs, and then he went on to heavier and heavier drugs, and he actually had an addiction. So the addiction is where there's a psychological, in other words, the person actually, they crave it, they will do anything to get the drug, and like the youngsters today, they steal whatever they can get their hands on. And when we use morphine as medical doctors, first of all, there must be a reason to use it. So the reason to use morphine in your case is because you've got severe pain.
Yes.
Let me ask you, how's the pain affecting your life?
Most of the time I just want to lie down because, if I try and move a little, then the pain comes back.
So this pain is it almost interfering with your life?
Yeah, like I say, I don't even take the dog for the walk anymore because
Now,
I'm getting
right.
a
So
lot of pain.
that's why you've got an indication for paracetamol, the Panado you're using.
Okay.
It's a painkiller, okay? And as you say, it maybe helped before, but it's not helping now.
No, it's not helping.
So when somebody's suffering with pain, we've got what we call a step ladder of pain treatment. And in fact, moving up to using this morphine is internationally accepted as the proper management of your pain. So the first thing that I'd like to do is I want to reassure you that we won't be putting you on this morphine if it was not necessary. And also, you need to understand that I'm aiming to improve your life. You complaining of the pain?
Yes.
I want to help you. And when you're using morphine, you don't develop addiction when you have pain.
Okay.
But what you will develop is maybe what we call a tolerance. So the longer you use the morphine, generally the pain and the cancer is going to get worse with time. And so if your pain gets worse, you may need a bigger dose of the morphine.
Oh,
Okay? You understand what I'm explaining?
yes, I understand.
And so there are also other side effects of morphine. The number one thing is that initially it can make you a little bit drowsy. When I say drowsy, I mean you may feel a bit woozy, but it's not going to put you to the point that you won't be able to do things, that you won't be awake. Okay? Number two is that you generally develop a tolerance to that drowsiness, and then your brain no longer is affected by it, and you become able to be at your full senses. You'll be able to look after the dog, and hopefully even take the dog for a walk. Okay. The third thing is that the morphine can cause some nausea. that nausea, good news is that I'm going to give you a tablet called metoclopramide or Maxilon, and that tablet you're going to take a half an hour before you take the morphine, and that's going to help with the nausea.
Okay.
Again, you will develop a tolerance, so your body gets used to it, and after about 5 to 10 days, the nausea goes away. Okay? The third thing that the morphine causes is constipation. And unfortunately, that's one thing that just doesn't, you don't develop tolerance to it. Okay? So for that, we make sure that every day you are going to take a regular laxatives in order to make sure that your tummy is going to be, your bowel is going to be working okay. How does that sound so far?
Okay. No, thanks for explaining it for me. I think I really want to really get this pain a little bit better. So I'm willing to give it a try, doctor, and see how the
Okay.
morphine goes. Yeah, I think I'm willing
That
to try.
sounds very reasonable. So let me explain how we're going to use the morphine. So the morphine is going to be in a syrup form. It doesn't taste so nice. So when you do, you could mix it with some juice,
Okay.
just to make the taste a little bit better. But you're going to get a syringe,
Okay.
and in that syringe you'll be able to draw up how many milliliters. So on the syringe, it's a normal syringe that we use. There's numbers on the syringe, and we're going to start off with 5 mils, so number 5.
Okay.
And just to make sure that you are confident, I'm going to give you a syringe that only draws up 5 mils.
Oh.
So you can't take an overdose.
Oh, okay.
Okay, so you won't be able to take too much.
Okay.
The other good news is that the amount of morphine that I'm going to give you is I'm going to give you a limited amount.
Oh.
So that you won't even have enough morphine to be able to take an overdose. Okay? Then the morphine is taken every 4 hours.
Even if I don't have the pain, doctor?
Even if you don't have the pain. Okay? So when we start, you said your pain is 8 out of 10. Right? Now, how would you like your pain to be? Would you like it to be 5 out of 10, or do you want the pain gone completely?
I want it gone completely.
So we want to aim to get your pain under control and have you pain free. Unfortunately, I can't promise no pain, but I can definitely promise an improvement in your movement, your sleep, hopefully, and hopefully we'll be able to get that under control.
Okay.
What if you take the dose of morphine and you're still in pain? What do you think about that? In other words, I give you the dose that we start with, you take it, and within an hour or 2 your pain is back.
And you said I must take the 5 mils.
Yeah, so you've taken the 5 mils, so what we can do, we then call that breakthrough pain. In other words, you're uncomfortable before your next dose.
Yeah.
The pain is back. Then we're going to take half of the 5 mils, so 2.5 mils.
Okay.
And you take that dose for the breakthrough pain, but you still need to take the dose, the 4-hourly dose. Understand that?
Yes, I understand.
And I'm going to give you a pamphlet on a page. And on the page, you're gonna write down when you took the morphine, the time, as well as the dose.
Okay.
And then in 2 days' time, I'm gonna phone you, and I'm gonna find out how it's going, whether your pain is better or not. Are we getting control? And this is gonna be a process. I'm gonna support you through it, and hopefully we're gonna get some improvement in your pain control.
Yeah, thank you very much, doctor.
Does that sound like a reasonable plan?
Yes, it sounds like a good plan. Thank you.
And then lastly, are there any family members now?
No, doctor. As I said, I'm just living alone, and I don't have a close family around.
And what about neighbors?
I do have neighbors. I'm living with, I would say, living with a friend, and so I've got neighbors who can help me.
Okay.
Yeah.
So I think it would be helpful to maybe let your friend be aware that you, do they know that you've got cancer?
I haven't told them.
Okay,
Yeah.
is this the kind of friend that you would maybe tell?
Yes, I think you would be the first person I can tell.
Great. And then, I would suggest, so as I mentioned, the morphine can make you a bit nauseous, can make you a little bit drowsy. And, it would be good if somebody other than just your dog, what's your dog's name?
Lexi.
Maybe other than Lexi, Lexi, she's a nice companion, but
Yeah.
it would be good if somebody can check in on you
Yeah.
and make sure. And lastly, during this time, and I know you may still want to go to work and drive,
Yes.
but I think when we're initiating the morphine, I'm going to give you a letter to give to work so that we can give you some sick leave, just so that we can get your pain under control until we can get you safe to drive again.
Thank you very much. Yes.
Okay. Do you have any questions?
I mean, I'm gonna take this morphine for a long time now.
So I think what we're going to do is that we're going to take it step by step.
Okay.
So for now, I'd like to first try and get your pain under control.
Okay.
And if your pain is under control, then we can use it for a long time.
Okay.
But for now, my first aim and objective is to try and get you more comfortable, get your pain under control, and make it safe for you to be able to drive and go to work, and as we plan and we care for you going forward.
Okay. All right. Thank you very much, Doctor.
Thank you very much, and thank you for coming in today again.
Thank you very much.
Okay.